So you just heard us all talking about collective action. Well, that's exactly going to be the topic of the next session. We're going to talk about the role of strengthening collective action for integrity in health, with a particular focus on the role of consensus frameworks. All of you who attended yesterday's sessions will have seen Brazil just having launched their own consensus framework. I'm really thrilled to introduce all of you today to Karen Aiolfi, Chief of Staff for Enterprise Risk and International Markets in the legal, ethics, and compliance space of UCB Pharma. Karen, it's really great to see you. Karen is also the chair of the Intergovernmental Organizations Working Group of the Ethics and Business Integrity at the IFPMA, or the International Federation of Pharmaceutical Manufacturers and Associations. Karen, thank you so much for your tremendous championship, and I'm going to turn the floor over to you now. And for members of the audience and your awareness, I believe we are still waiting for one of our speakers for this session. We'll go see if the speaker is having any technical difficulties, but in the meantime, we'll begin the session. So Karen, over to you.
Thank you very much, Andrew, and thank you, everybody. It is an absolute privilege to be here today. And I was listening to the sessions yesterday, and I'm looking forward to the rest this afternoon. So thank you again for the opportunity. It is my great pleasure to be able to introduce to you two speakers, one of who is here and ready to go, and we'll surprise you with the second one. And that's Gemma, Gemma Aiolfi, who's coming from the Basel Institute on Governance. She's the head of compliance, corporate governance, and collective action. I have had the great privilege to know Gemma for a couple of years now, and I can tell you she's literally written a book on compliance and in small to medium-sized enterprises. Before Gemma starts us off, and then we'll have Hector come and join us, I wanted to just talk for a moment about the inspiration for somebody like myself within an ethics and compliance group within legal affairs in a medium-sized pharmaceutical industry or pharmaceutical company. There's something really important about that aspect of collective action, and that is that this is really an opportunity for us to rebuild public confidence. And I think our previous speakers from the previous panel have really gone into the importance of confidence, rebuilding confidence, and that the nebulousness and of trust, like something that takes us a very long time to earn, but unfortunately we can lose it very shortly. So it's a very fragile and important thing for us. And we know that it's key. The other aspect around collective action, and that speaks to me very, very strongly, is that we have a theory of the way we do things, but we actually need to practice them, because that opportunity to practice in doing something is when we learn how our concepts are impacting in an environment. So it's a bit what we do to the environment, what the environment does to us as well. So there's a great deal of learning and development for us to continue as we work with collective action. I think it's also a great opportunity, and I'll pick up a comment that the previous speakers mentioned, is to bring the person who we're providing the service for, who is looking for this change in the environment. That is what we would call in design thinking a user. And we want to bring those challenges and the experiences of a user into the way we create policy, process, and procedure. Having this user informing us is incredibly important, because again, we can move from theory into practice, and gaining that. It's also gaining trust. It's building empathy. It's helping us understand other realities. And so I think on that portion, collective action speaks to me very, very strongly. So I told you a little bit about why I'm inspired. Let me turn it over to Gemma right now, who will continue to inspire me, and I'm sure will inspire you. And we'll come back to you for our next speaker. Gemma, the floor is yours.
Thank you so much, Karen. Good morning, everyone. Thank you for the very kind introduction and for the great honor of the invitation to participate in this session today. My thanks also to Andrew for this opportunity. So we're looking at strengthening collective action for integrity in healthcare and the consensus frameworks. So allow me to start by picking up really what Karen said about how to translate policy into practice, and sharing a couple of real examples of the typical challenges that pharmaceutical companies experience, certainly in some markets. So earlier this year, I was working with a mid-sized pharmaceutical company, helping them to strengthen their internal compliance program. The marketing director explained how the public officials in the Ministry of Health in his country always ask for free samples of one of their low-cost generic products. And he said these are handed out as a sign of goodwill and accepted as normal. It's done quite openly. It's all part of maintaining good relations with the ministry. and the marketing and export licenses his company needs for their products continue to be issued by the ministry quite smoothly. The management of this pharma company would like to stop this practice, but believes that this will be almost impossible in practice. I'll stop there for the moment with that example, and let me mention a quite different second one from a different country. So a pharma company is exporting its generics within the local region, but is planning to expand its business into new markets. And to do this, we had discussions with them about how to improve their internal integrity compliance program to meet international best practices. But in that company's home country, there is no specific law that regulates the marketing and sale of pharmaceuticals. And it has to be said, unethical practices are common, with companies, hospitals, and doctors overcharging patients for treatment, among many other issues. There is, though, a voluntary code for marketing practices, but it is not enforced beyond naming and shaming, which means that companies that engage in unethical behavior continue to operate. The company that wants to raise its standards of integrity and compliance is willing to implement the voluntary code on marketing practices, but is discouraged from doing so because it will be one of the very few local companies trying to change the way that its medical representatives behave in a fiercely competitive market. So these real examples illustrate some of the integrity issues that confront healthcare providers and pharma companies in markets where bribery and unfair business practices can undermine the focus on patients and their needs. Collective action, I believe, can be relevant to both of these situations. And why do I say that? First of all, public health in its broadest sense is a public good. But healthcare is not only the responsibility and preserve of governments, the private sector plays a key role, sometimes in partnership with government agencies, and certainly when it comes to licensing and standards for pharma production and marketing. So we all know this makes healthcare complex, with multiple interests, many laws and regulations, combined with discretionary powers at government level, and the stakes are high. And there is corruption risk in every country in the world, in both the public and private sectors. So healthcare systems are often vulnerable to illegal and unethical behavior in the public and private sectors. So collective action provides a method to address these risks, and it's a tool that has really evolved over the last 20 years or so, giving us a lot of variety and scope of these different initiatives. These initiatives also involve quite tailored approaches in some cases that apply collective action as a means to pursue solutions to systemic issues of corruption, weaknesses in governance, and a way to promote fair business practices. So when we look back at the company that hands out free samples to Ministry of Health officials, there's clearly an opportunity to get together with other mid-sized companies who are very likely similarly expected to hand out free samples of their products and to work to eliminate this practice, perhaps even bringing in the government authority at the right moment. So in the second example I mentioned, where laws and regulations are weak or non-existent, this could be a suitable opportunity for a consensus framework. But for now, that country doesn't have a consensus framework, nor is it developing one. So we have recommended that it get together with its National Pharmaceutical Association, Industry Association, and try to get together with other companies to start working on how to strengthen the implementation of their voluntary code, because it is there and it's a robust document, but it needs to be implemented. Now, we also know from our long experience of working with different initiatives that collective action is not an easy option. It isn't a solution to every issue that undermines integrity, but it can help. So getting an initiative started and making it effective takes a lot of effort, time, and needs leadership that we heard about, I think, earlier on, expertise and inspiration. Some of the common challenges include developing trust between the participants, handling stakeholders with competing or diverging interests, and that's perhaps particularly noticeable within certain areas of healthcare provision, addressing governance structures, and making collaborative efforts sustainable. I'm sure that some of these challenges sound familiar to the health sector consensus frameworks in countries both with developed economies as well as those in emerging markets. So how can we strengthen or try to strengthen some of these collaborative efforts? So here are 5 things that you might want to consider, some of which may sound already familiar, but it doesn't harm, I think, to come back to these sometimes. First of all, bringing together stakeholders and sharing their experiences, their successes, the problems and possible solutions is not only useful in itself, but it actually also helps to foster trust, especially if it's constructive and not a finger-pointing exercise or oriented towards complaining. In other words, looking for what we have in common that's positive and not always looking to put the blame on one particular group. Because as we've said, these problems are complex, so we need to have constructive ways of addressing the issues. Secondly, the impact and power of collective action is often strongest when the participants are relatively homogeneous, because this helps the identification of common goals, as well as common problems, of course. So I think the consensus frameworks may benefit from encouraging sub-working groups that bring together similar members to create their own initiatives, but still aligning with the overarching ethical principles that the frameworks put out. To achieve this, governance structures for the consensus frameworks need to be enabling and provide flexibility, but also clarity, accountability, and transparency. So really working together to figure out the best way to structure these frameworks to get results is a task in itself. Third idea, what we've also seen from other initiatives is that data-driven initiatives can really help to focus actions and have an impact, because they can create a baseline and demonstrate what has changed based on facts, not only on qualitative assessments or anecdotal evidence, which of course is also valuable, but what really talks at the end of the day is having hard data to show how change has been brought about. I think many healthcare organizations are probably well placed not only to collect, but also to deliver that data to these consensus frameworks and their initiatives, so that they can set a baseline and encourage the development of targeted collective action. Fourth, and this is pretty important, although it might sound a little bit unusual, charismatic and engaged leadership can be decisive and can make the difference between success and failure. We've seen this time and again in collective action initiatives. A person who is respected within the healthcare system, who can identify how best to draw on the resources available within the participant group, who can really push people to do things in the nicest possible way, who doesn't give up. This will be an invaluable asset to the consensus framework initiatives. And fifth, sometimes being opportunistic is a smart move. So being flexible and adapting when necessary, swooping in and taking advantage of a new law, the willingness of a new participant or a new association to change the way they've been doing things provides opportunities that shouldn't be missed, so that the collective action can achieve its long-term goals. And this may also involve building in resilience into the collaborative process. So those are just 5 things that I think, from what we've seen, might help some of the consensus frameworks as they progress. Let me close perhaps with one special announcement, if I may. At the Basel Institute, we've developed our support for collective action through mentoring and facilitating various initiatives. We've been drawing on examples and discussions held with different stakeholders over many years in all types of collective action. And so we offer practical advice and encouragement. We share our networks and contacts and try to bring new perspectives to keep the momentum going so that the collective action initiatives achieve their goals. In practical terms, we have convened gatherings of diverse groups that have shared their experience and developed new networks as a result. We've held regular conferences on collective action, and we'll be holding another one, we hope, next year for the first time for a couple of years, and we hope it'll be in person. As well as that, in the next few years, I'm pleased to say we will be scaling up our mentoring activities, and if we can support any of the consensus frameworks as they develop, we will gladly do so. This would involve assessing together with the respective framework or its sub-working groups what this would involve in detail, but we will have the resources to do this, and so our costs would be covered. We are a resource centre for collective action, And we really look forward to supporting the efforts of the worthwhile consensus frameworks and strengthen these initiatives where we can. So we look forward to hearing from you and working together with you more closely. Thank you very much, Karen. I'll hand it back to you for now. Thank you.
Thank you, Gemma. Thank you. So inspirational as always. And I'm going to turn us over now to Hector Valle Maestro, who has joined us. And hello, Hector. Hector's the executive the executive president of the Mexican Foundation for Health, which is Funsalud. And we've had a chance to hear in our previous discussions a bit about some examples of collective action. And Hector, I'll turn the floor over to you to tell us a bit more about what Funsalud is doing and your experiences there. So thank you.
Thank you very much, Karen, and also Gemma. Thank you. It's nice to see you, and Andrew also. We agree that collective action is really a thing that we have to work all together. You know, that's critical now at this point, at the stage in time in healthcare. How do we see things? First, we think there's a lack of access to healthcare. When we discuss about it, it's a lack of access around the world. This lack of access typically is driven by, first, lack of human resources, having the right resources and time. We sometimes, specifically in underdeveloped countries, what we see is that the countries have a lack of physicians, for example, or nurses, or physicians with certain specialties. So the lack of those specialists would make a difficult way for the population to get access to healthcare. A second point is where there's a lack of infrastructure, okay? So maybe you have the physician, but when the physician prescribes you a specific study to be done, maybe there's not the right equipment in that specific city or population. If we think that at one point in time it gets to be available, then there's a third space. If there are the medicines or the pharmaceuticals available for the population. So when we look into that, the lack of access is driven by the missing one of these three pieces, or the human resources, or the infrastructure, or the devices or pharmaceuticals. So one of the things we've been working within Funsalud is how we all work together to make this thing really matches in time to really have the different products, the physicians and the infrastructure available. So at one point in time, there's a lot of work to be done between the society, between the government, between the business community. So I think there we go into this, how we're going to solve all things together. And then we go into the ethics part of it, how people work together, how we find the right leadership, as Gemma was saying, how we're going to make things happen. And we, of course, we think we have to put everyone at the table with different interests and make things happen. Actually, in Funsalud, we're working different initiatives around the Latin American environment. Well, what we see is we develop what we call the lab for inequities in healthcare. Okay, so we go, or equities, trying to find equities and the right access for everyone and time to be and guarantee that there are not big differences in the different persons and the different populations. So there's a lot of things to be done in this arena. We agree that we have to make things happen in putting business people, pharmaceutical industry, physicians, government, business sector to work together in really driving the availability of healthcare to everyone. Two of the things I want to put emphasis, first, the business community. The business community has to understand what's their role, how they work together, and how they work together with the government, precisely in dealing with the different situations. What are the things that one's requiring, specifically when the business community is asking specifically for support, for example, for their own employees, okay? To guarantee that the different institutions, the governments are really giving access to healthcare to those employees of the different business communities. And how they work together with the government in making that happen. Who puts what? How they work together. How they deal with the risks and challenges they're going to be facing. Because there are too many risks they're going to be facing. When we look at how things develop, when we look at now what happened during the pandemic, how it's been happening around the world, there's a lot of work to be done. And these examples that Gemma was explaining about the relevance of working all together, doing all these collaborative initiatives, I think that's critical. How we work together, how we make things happen. We also find that groups like Gemma's groups or like Funsalud groups or some other groups are critical in helping the groups getting together, working together, understanding what's the role of each group to make things happen. So one of the things we invite everyone is to really work together with people that can manage the discussion, can help through the discussion, can drive things to make things happen. And as Gemma was saying, I think it's critical to have the right KPIs. How are we going to measure things for everyone, from the academic, from the government, from the business, from the patient, from the industry, no matter what, it's the medical devices or the pharmaceutical industry are going to get together to make things happen. And then how we're going to measure that to make sure that we really are delivering on time, on benefit of the different populations. Having said that, I think it's good, Karen, to turn it back to you and see if we have some discussion now between us. If not, it's only us speaking, and that's not going to be nice.
Thank you, Hector. Let me just actually open it up to the three of us to have a discussion. We have a few moments left that we could do that. I love the discussion around shared purpose. I think that that's incredibly important. It's like I always envision it to be a seat at the table, and there's a very large table, and we can all find seats around it. And I think that that's a visual that I really like to work with. Maybe in both of I could have a comment from both of you. And it's also, if I'm thinking about the audience that we have on the call, we've got some very specific actions that you've described. And when things work well, it really does work well. Let me ask a question though, more about how do you motivate yourself when sometimes it seems there are a lot of challenges? What do you find is your source of inspiration? Maybe Gemma, I'll turn over to you, and then Hector, you could give us a comment.
You mean the participants in the collective action initiative? How do they
No,
motivate?
no, sorry, your personal motivation for the work that you're doing. You could expand it to the table, sure, right?
Okay, I think my personal motivation is that I genuinely have seen how things can change. And even if it starts in a small way and takes many years, I mean, I've been around doing this for many years, things that you think are impossible come back and then they suddenly become possible. I mean, when we first started out in collective action, the very basic approach was bringing companies together to say, we will no longer pay bribes. Nowadays, that's completely the minimal that people have to do based on the law. So when you see change, when you see things really being improved, the impact gives you a huge boost to get even over the hurdles and the bumps that you see arising. And as I said, some of the things that are really encouraging are data-based, as in data-driven. So when we know that, for example, facilitation payments or bribes were being paid in the thousands of dollars for things that should not have cost anything at all or very little, and governments public officials are maybe demanding payments, and then everybody comes together in a collective action, and everybody realizes that this really has to stop, and it has done in some cases, then you can see a win-win-win. Companies benefit from the bottom line, governments get to be cleaner, better reputation, and services to the public, which is what we're talking about here as well in healthcare, will improve because money gets spent in the way that it should be spent, not improperly moved away. So this is hugely motivating to me, I have to say. I think it's also motivating to initiatives when they see a success.
I think so. Thank you. Thank you for that. Hector, maybe a few comments from you on your inspiration.
I would say we're very results and data driven. Okay, so when we look at what we're trying to do from a healthcare perspective, that's giving access to the population to healthcare, there's nothing as that makes you feel so good as seeing the people going to a hospital and really getting access to healthcare. So when you put everybody to work, when you put the right targets, the right initiatives, the right things happening, and you see that you're delivering, that's great. When you see a happy face of a person getting support from a physician and getting the right studies made and the right prescription and things happening, that's got to be positive. From Funsalud, there's only one big thing. We have to make access better on a daily basis. So every time we move, we know we're moving in the right direction. And yes, we go through things that Gemma was saying about in the process of it, suffering a little bit of discussions with government, discussions with private players, is exactly around the private discussion. And then you skip it and you make that there's one thing to be done, give access and put that resources in really giving access. So for us, access to healthcare is a key motivation, and making people getting it, it's what drives our daily lives.
Thank you very much, both of you. As such experienced practitioners in the field, I think it's been a real pleasure to talk to you today about your collective action experiences, and also about your personal experiences and the inspiration. I go to these meetings and I think these are all the things we can do. And sometimes the hill will seem very high, or the road is very long. But to hear from both of you that, the impossible becomes possible, I think it's a great way to reinforce our shared purpose and finding our way forward together as all interested parties here. I want to thank you both. Andrew, I'm going to turn it back over to you in just a moment before I thank Gemma and Hector. First of all, the conversations have been great. We've really appreciated the discussions and your experience, and we look forward to continuing the conversation. Thank you. And Andrew, I turn it back over to you.
Thank you so very much, Karen, Gemma, and Hector, for your insights. And I'd like to echo the comments that all of you have made, that stakeholders attending the forum who are really looking to learn more, right, about effective collective action initiatives and to foster ethics in healthcare, be it through consensus frameworks or otherwise, should absolutely reach out. I think if the discussion we've just had and the one before it between the IDB and CONFIP tells us anything, it's that there is a large movement afoot to really promote collective action initiatives within ethics and integrity, in particular in healthcare. So thank you all so much.